I am Dr. Philip Macmillan, and just again having a quick chat about one of those very controversial points. And what I want to do is give a clinical perspective on this very emotive topic about COVID vaccines in order to have a child organ transplant. Now, this is in place already for adults, and it's also, depending on where you are in the world, relevant in terms of children. But the question is it actually good ethics? It's a tough question and one that I'll quickly get into. The first thing that I'll do is I will put into context the conversation that happened with regards to a case on Fox News. And, they can be a little bit controversial about what they're saying, but I think that the point is worth reflecting on. And so I'll quickly share this with you, this discussion with Tucker Carlson. So take a listen to this. At this point here, I'll pause it because you get the general gist of the story. The general gist is that patient in this case needed a kidney transplant and they couldn't get it because they weren't vaccinated. So, what really is the recommendation from the CDC? So, the first question is where did they get that from? And so, you have to be careful not to blame the hospital because they are taking their guidance from the CDC. And the CDC has special recommendations for solid organ transplants around COVID-19 and vaccination. And specifically, what they have said is given the effectiveness of COVID vaccines in the general population and the increased risk of worse clinical outcomes with COVID 19 vaccines, they would recommend that all patients receive COVID vaccines. Ideally, solid organ transplant should receive COVID vaccines, either primary, series, or booster doses, whilst they are awaiting transplant. So that's the recommendation from the CDC. So, in a sense, the Duke Hospital in that case was following the recommended guidelines. Now, you have to remember that this is for the US, and the US has to follow the CDC guidelines. But what is it like, say, for instance, with regards to the UK? When you look at the UK, for example, and this is the latest guidance with regards to COVID vaccines for patients and recipients. This is the 1st of December 2022. And the latest guidance here is you can receive a transplant whether you had the COVID vaccination or not, as long as you are eligible. And so it's not dependent on vaccination status in the context of the UK. So it just depends on where you are in the world, sadly. And the question is, why are they saying that in the first place? And it's largely because the CDC is saying the vaccines are effective. So therefore, there's no good reason for someone who is going to undergo a major procedure to not be willing to have this vaccine that could add a level of protection from infection. And that's the logic. It's very simple. They're saying that we're willing to do major surgery, we're willing to take an organ, we want to minimize the outcomes from every single angle. And therefore, if getting COVID could create worse outcomes, which is what the research suggests, then a COVID vaccine would make logical sense. That's if the COVID vaccine actually protects. That's one other question. But the truth is the research suggests in the few weeks and months after vaccination, it does have a protective effect. So it makes logical sense. However, this is the part that I was interested in because I think the biggest piece of the puzzle was actually missed. Now, the question is in the context of the solid organ transplant. So this is a paper here. So this was from June 2022. And it's the impact of COVID-19 on the pediatric solid organ transplant population. And I think that this was published in the US. And the question I was having is, what were the outcomes? And when you look very carefully, and I'm going to show you this here, they were looking at the general impact of COVID-19 on solid organ transplantation. And what they found was that when they looked at the cohort, and I'm trying to find that section that I was looking at, there was a cohort of patients. I'll come back to that in a second. But essentially, what they found in the first cohort of about 106 patients, there were no COVID-19 deaths, even though they were immune suppressed. In the second cohort of about 866 patients, they found, and I'll show you here now, I've got it here now, in a special registry for heart transplants, 866 pediatric heart transplant recipients, 14% required hospitalization, 5% required intensive care, and less than 1% died. Okay? And this is the point that I think is extremely important. It does seem that immune suppression is protective against severe COVID-19 because the logical thing would be that these children should be at the highest risk for severe COVID-19 if the virus is the center of the problem. But as we know with the cytokine storm, the cytokine storm is around the immune response to the virus. Those who are immune suppressed, strangely, seem to have some degree of protection. And this was also observed in the paper. They did actually say that. It was surprising to them that it seems as though these patients have degree of protection from COVID-19 in a way that you wouldn't have anticipated. And that fits with what I've always been saying, that COVID-19 is a viral mediated autoimmune disease. And so, therefore, any kind of immune suppression is likely to reduce the risk of severe disease rather than increase it. And it's that piece of the approach that I think is missing. If we had better understanding of the disease, there would be less likely that we would be having these bits of confusion about what to do. Children generally are at low risk for severe COVID-19, and children who are on immune suppression, strangely, are even at less risk, it seems, for severe COVID-19. And so, therefore, insisting on the vaccine could be considered to be unethical. And this was just what was pointed out in this paper here. The case against COVID-19 vaccine mandates in pediatric solid organ transplantation. And this was looking at that question about whether or not it was appropriate. Their conclusion is that making solid organ transplant listing contingent on COVID-19 vaccination is problematic. And although there is some risk of harm for the candidate remaining unvaccinated, the risk of harm of not being listed and transplanted is greater and overriding. So that you can see this. This is the risk of harm of not being listed and transplanted is greater and overriding. And so it comes back to the point, the better we understand science, the better we understand the science around COVID-19 and not make assumptions about who should be most affected. Instead, let us look at the data, follow the science, and use the science to instruct us as to how the disease is going to operate. So that's my talk for today. I hope you found this valuable. It's a little bit more about the science perspective. But again, if you want more interesting posts, videos, and podcasts, join me on Substack. Have a great evening.